All right.
Yeah, so like I said, yes, something called a tumor board, where the hematology team and the cardiology team, we spoke together at length about what next steps should be for you. So you do have what we call smoldering multiple myeloma,
Smoldering.
meaning it's not full-blown myeloma, uh, but it's at going towards that path. And we're going to recheck labs to make sure it's not acting more aggressive that might require treatment just for itself, the myeloma component. There's also a concern because your bone marrow biopsy also showed something called AL amyloidosis.
Yeah.
But we don't know if that's what's going on in your heart. We can't 100% say that's AL amyloidosis. You might have another type.
We don't know for sure if it's AL amyloid in the
Yeah.
bone marrow either. We just
Right.
know amyloid.
Yeah, so it's just amyloidosis, what we call subtyping. It's being done at another facility, and that's what we're waiting for. Given the poor prognosis that the cardiology team feels in terms of your heart, the conversation became whether we should be treating you with chemotherapy inpatient. And that's why we're here to talk to you about the risks and benefits. Okay? So from our perspective, given your age and the poor the prognosis that the cardiology team is
There's another one.
Given the heart health, they're really worried that it's very dangerous. You had arrested, your heart stopped, and they had to bring you back to life. We think there's more benefit than risk in terms of starting one round of chemotherapy here, and while waiting for the subtyping. Even though we don't have it yet, we want to give you chemotherapy. Again, that's what the understanding that we don't 100% have your diagnosis at this time. We're treating out of abundance of caution and worry that this is AL amyloidosis. How do you feel about that?
Tell you honestly, I'm completely, let's say, clueless. Because I don't have any idea about this disease. How did I get it? I was very surprised,
Yeah.
because I was just expecting that, for the, let's say, congestive heart failure. I'm not surprised about that, because my grandmother died of it, my father potentially died from it, my mom saying, and we all have pretty bad diabetes. But knowing that it could be multiple myeloma or this amyloidosis, I'm quite, let's say, clueless, really clueless. So about the treatment, I already spoke to my family. It's like I told them, it's like I will let the doctor decide what's best for me,
Okay.
because I don't know it myself.
Yeah.
I don't want to second guess.
Yeah. We appreciate that. Now, in the meeting that we had yesterday, it was a meeting of all the blood cancer specialists, plus the cardiologists were there at our meeting yesterday. The consensus was to offer the chemo to you because the cardiologists were incredibly worried about how aggressive this is behaving in your heart.
Exactly.
And even the doctor that you were going to see in Long Island was in the meeting as well. And that was the team consensus, everybody. We felt weighing the risks and benefits because of how aggressive this is behaving, we should go ahead and treat you, because this could take a long time to come back from the Mayo Clinic, the test. It could take, and then they may even say there's not enough specimen, and then we're really stuck. Plus they said that at your age, the kind of amyloid that is specific to the heart, not the one that we treat, but the one that's specific to the heart, is very rare at someone your age.
Yeah, I know.
And so that's why they were thinking this is probably light chain amyloid, which is what we treat.
Right.
And it's oftentimes seen with myeloma, which we discovered in your bone marrow as well. So our thinking is that we should go ahead and start treating you.
Sure.
Yeah.
Sure. It's like, what treatment, what kind of drug, side effects can you?
So, The medications we want to treat you, it's a multi-step regimen where we give you essentially three types of chemo meds and steroids. Okay? And there are multiple cycles to the regimen, meaning you'll get it multiple times, even once you're outpatient, but that really hones on what we get in terms of the results from your testing that was sent out to the Mayo Clinic. Here, we're going to treat you in a certain way, so you're going to get treatment on certain days.
Oh, you got that also from the chemo? What's
Yeah,
it called? That's
yeah.
awesome. I
Yeah,
gotta check
so-
it out.
Thank you, then.
Oh, hi.
So,
Everything okay?
Yeah, we're just talking about giving him chemo.
So these four medications, daratumumab, which is an antibody medication, it's not chemo. Cyclophosphamide, that's a chemo, and bortezomib, these are chemos, and this is a steroid. You're going to get it all at day 1. We're going to check your numbers, see how you're doing. Then you're going to get it again day 8 and day 15, so every 7 days. Okay? And there's 22 days in this one full regimen, one full cycle. Okay? Now, the treatment is every 4 weeks. Again, the 4 weeks component, we're gonna, by then, hopefully the goal is that your results come back from the Mayo Clinic. The side effects are,
What is-
so these are just future cycles. The number and the way it's treated changes a little bit. But again, I would worry about just cycle 1 this time, because that's what we're doing in-house.
Good.
Okay, and that's where the goal is to start treatment either today or tomorrow. And side effects are the typical side effects that you think about when it comes to chemo. Your white cell numbers, the numbers that help with infection, they may drop down because we're affecting your immune system, and just your factory, your bone marrow factory gets affected. But again, we monitor those levels on a daily basis. You might have nausea, vomiting, maybe some component of diarrhea. But again, we monitor you while you're here, and we treat you with supportive medications. Okay? And then go through this.
So let's say for the whole cycle, or the whole month.
No, you wouldn't be here for the whole month. So typically we keep people here for maybe a few days of those cycles and see how you respond. And if the treatment is what we want to continue outpatient, we would be able to let you go home. And you could follow up with whichever physician you would like to follow up with.
Yeah, Dr.
Steinberg or
Caro
Dr.
in Long
Caro.
Island was expecting you, so but she knows all about you, so she was in the meeting, so potentially you could
Yeah.
follow up there. Yeah, we could give you the chemo here, and it's given in the outpatient you normally, but we'll have to give you the first one here just to observe you, make sure you do okay on
Yeah.
it.
Okay.
You can
It's
go through,
given
this is
every-
yours to go
it's-
through the schedule.
The side effects again?
Side effects, kind of bone marrow suppression, meaning your white cells, your red cells might go down during the treatment, a few days after the treatment. Then you begin to come out of that, and they begin to improve, and those numbers are closely watched, even outpatient or inpatient, wherever you're getting treatment. Nausea, vomiting, diarrhea, those also may be components of the side effects. And again, we would give you supportive medications for those.
And restriction, diet.
Diet restrictions, we don't typically
No.
give you diet
Go to
restrictions.
town.
Yeah, you should
Eat
enjoy whatever you want to eat.
Whatever the cardiologist says.
Yeah, from the heme perspective, from the cardiology perspective, they might actually have restrictions
It doesn't
in
matter
terms of
for us.
sodium.
Right.
Yeah.
How about will I go bald? That
That
I really don't care.
With the Daracibert.
Sometimes
Some
a little
degree-
bit.
some degree of hair loss
Sometimes
may occur.
it depends. This one is it depends. Sometimes I see people lose some hair, sometimes not. I would say 50% chance of hair loss for this.
How about will I be able to sleep at night? Because I have a
Yeah.
patient who has multiple myeloma. I bring him every week to MSK, Nassau.
I think you'll be able to sleep. Yes, there's
Yeah.
you're going to get a steroid dexamethasone,
Alright.
and that can keep people up at night. But if you take it usually in the mornings, It's once a week, so it'll
Right.
be, if it's earlier in the day, then it won't cause you to stay up.
Right. Because every time he'll have this chemo, let's say, session.
Yeah. Once a week, you could have insomnia.
Yeah.
Once
There
every
may be some
7 days.
other side effects that are causing discomfort, but outright sleep shouldn't be affected.
All right. Sure.
Okay. So, what I need is I need your permission for us to allow to give you chemotherapy and the medications we went through. So I just need your signature here if you can do so.
Sure.
Right over here, you're gonna sign, giving me permission to treat you with these medications and the fact that we kind of went through all the side effects and we answered the questions that you're concerned about.
And you wanna start that right away by tomorrow?
The goal is today.
Today.
Or tomorrow. Okay, we're gonna try to.
We have to get
We
you
have
to
to
the
try to
floor.
move you. We have to move you to the chemo floor where the nurses are who give chemo. So step number 1 is to move you over there.
Yeah.
Right. Okay.
It's gonna take us this.
I can write the rest. It's okay.
Deep breath. Okay. Okay. That's good. Very good.
All right. Thank you so much.
Thank you. All right. So I'll be transferred from this room to another room
Yeah.
for
It's
a
just
change.
safer for you to get the chemotherapy there.
I just hope that it can be by the window also. Hopefully.
Window. We can try requesting if there's a window.
Yeah, because I'm
there,
kind
yeah.
of claustrophobic.
Oh, because yeah, right now you're not even. Yeah, hopefully we can even have you get to see some of the
Some
city,
overview.
right?
Right. Thank you. Appreciate it a lot.
Thank you very much.
Thanks.
Take care.
God bless you all. Thank
God
you.
bless God bless you.